Hi, I'm Gregory Pope, founder of SpinalSurgeryMexico.com. Today we're going to go to the hotel to pick up Chris. Chris came in a day early and he stayed at the hotel next to the hospital, so we're going to pick him up. The next time you'll see us at Star Medica. Chris is going to have a revisional surgery done on his neck. It's either going to be 2 cages or 2 prostheses, but Dr. Simone will have to make that decision when he's in the operating room.
Hello there.
Hello, Dr. Simone.
Chris?
Yes, nice to finally meet you.
Nice to
This is
finally
his wife,
meet you.
Adriana.
Hello everybody, good morning. I'm here in San Miguel de Allende, Mexico at Casa Marino, making a house call for our last patient from cervical spine surgery, Mr. Chris Ouellette, who came from United States to have a review surgery because he already had a cervical spine surgery last year, but this surgery didn't help at all, so he kept looking for another option, and he found SpinalSurgeryMexico.com in the web, and finally he came here to Mexico, to Querétaro, Mexico, and had his surgery 6 days ago, just 6 days. And I'm making this house call to finally clear him to go back to the States. He had this previous surgery, doing a C4, C5 anterior disc replacement with a Mobi C kind of prosthesis. It's a trademark. And he didn't get the results he was expecting to. So after keep looking for a place to have a second opinion and to do if he could have another surgery maybe to fix his problems, he contacted us and we did this consultation remote by internet with our questionnaire, and he sent his images here. And finally, I decided with my team that we could help him. So 6 days ago, we took out that Mobi C prosthesis from C4, C5 and could be able to put another prosthesis, a new one. This brand mark is Rotaio from Germany. And we also did a prosthesis between C6, C7, which he had some problems also there with the disc and the compression of the roots. Now he's ready after 6 days to clear to go home, and everything it's been fine till now. A little bit of swollenness in the neck, but he's doing fine, and I think he's very happy. So first things first, I can see this is swollen, as it should be because of the 2 incisions and 2 levels of surgery. These are different levels. So it's gonna take out this, okay? Looks good to me, pretty good. Well, now, your arms like this, please. Yeah, perfect. Now down, perfect, like this, chicken wings. Perfect, now down. Okay, now squeeze my hand, please. The tighter you can, like a man. Just kidding.
Go take my spot for me. Fill in for me here.
Okay, perfect. And you turn your head to the right.
Now, we haven't been doing flex with the therapist, so I've been conservative on that.
Okay.
So I'll go to the right.
Okay, now to the left. Yeah, I think that at this time, 8 days after surgery, your range of motion is very good. Mm-hmm. But
yeah.
About a little bit to the back and to the front. Perfect. That's great. 6 days post-op. It's amazing.
I'm a specimen of good health now.
Yeah, of course. Yeah. Of course you are. So this is clean, still swollen, but it will go away, okay? You've been icing here?
Yes.
Okay, that's great. It will take time, maybe a couple of weeks, but you can go around without a pad there. You don't need it anymore. It's already closed. Yeah.
Okay.
You can shave if you want.
Yeah.
Just going in the same direction of the scars, okay?
Okay.
Not.
Yeah, and so normal activities in 2 weeks, or
Yeah.
yeah, yeah. And then I think Greg was saying there's a lifelong restriction on lifting above.
Yeah, weights. Yeah, lifting above or carrying very heavy objects. When I say heavy, it's more than 5 pounds.
More than 5 pounds?
Yeah, and it's not because of you had surgery, it's because you have to take care of your spine for good.
Okay.
If you don't want to end in an OR again.
No.
No way, Jose.
It feels like it's getting better each day.
It will be.
And just appreciate the work that you put into it. I know you spent a lot of time in there, looking around, making sure we get all cleared. So that's appreciated.
Well, I'm so glad you're clear to go home.
Okay, thank you.
You already have
you're
my
hero.
cell phone, so
Yeah.
anything you need, you just text me.
All right.
Okay.
Okay. Thank you very much.
It's been great meeting you.
Hi, I'm Gregory Pope, founder of SpinalSurgeryMexico.com. Today is August the 7th, 2023. I'm with Chris today. Chris just got checked out by Dr. Simone. He came here from Sanibel Island, Florida. He had a surgery in Florida and had an artificial disc put in his neck. They did not size it properly. Dr. Simone was able to tell, and he was having complications after his surgery there, so he started investigating on what to do to get himself fixed correctly. He got a hold of me in around April of this year, and he sent his studies, his questionnaire, his images, everything that Dr. Simone would need to see. He made a diagnosis. He spoke with Chris on the phone, had a phone consult. They got together. Chris went and had some additional tests done to pinpoint exactly where his problems were coming from for his own knowledge. And Dr. Simone and him got together and they came up with a plan. We picked up Chris, we took him to the hospital. He had surgery with Dr. Simone. He's been recovering here at Casa Marino for the last 4 or 5 days. And now what I'd like to do is introduce Chris and let him tell you about coming to Mexico and having surgery at Star Medica Hospital with Dr. Simone and how he feels about everything. So at this time, let me introduce Chris.
My name's Chris. As Greg said, I'm from Sanibel, Florida. I'm here after much research into various options, doctors. The decision to come here to work with Greg and Dr. Simone, I believe already was absolutely the right decision. As Greg mentioned, I had surgery a year ago, almost exactly a year ago, to fix the problem that was identified as a disc degeneration in the C4, C5. I chose a doctor in Florida who was highly regarded, great credentials, and promised to do a wonderful job. I knew almost immediately out of the operation in the following couple of days that I was not feeling any difference post-op versus pre-op. It caused concern. I was assured by folks that it takes time, and it does. You're not going to come out singing and dancing, but you should feel something a little different from the chronic pain that you felt from, in my case, 3 or 4 years prior to the surgery. But that improvement never came. And in having to do my own research, investigation into why that the improvement didn't happen, I worked with a couple of doctors to get images, opinions, and what we found is that the disc that had been placed in my neck was not sized correctly and was not placed correctly. So that was a problem. It meant that I needed to start over and go through this process, which is, it's stressful. And you want to get to the end. You want to have your life back. I obviously did not want to work with the previous doctor who didn't show the care to pick the right disc or place it correctly. I began my search first nationally and then internationally for a doctor that I could trust, because I learned the hard way that a doctor who is not focused on you and your outcome, as Dr. Simone is not a good choice. So for me, folks who are looking at doctors, the nationality is of almost zero. That's almost zero weight in choosing a doctor, whether it be Canada, United States, Germany, Mexico. Neither is cost, because you can't put a price on a good, healthy life. For me, I think the two main components are qualities, capabilities of the doctor. Are they qualified? And then the second one is, are they focused on you as a patient? My first doctor is an example of not having checked both boxes. He was qualified, but the focus wasn't there. I began to see through Greg's videos that the patients coming out of Dr. Solomon's procedures were saying that he was wonderful in both, and that's what led me here to Querétaro, Mexico. And as I said, I'm super happy that I did. Dr. Simone's been wonderful. He took an extraordinary amount of time to remove the poorly placed disc from the previous operation, and not only that, cleaned out a great deal of bone work that should have been done previously. Took the time to ensure that the passageways were cleared, that the discs were in the correct position, and that this was not something I would have to repeat for a third time, which is unthinkable. He's also been extremely wonderful in his follow-ups. Actually, the information that he shared prior to the operation, and then the visits afterwards, including up until today, where he checked me ready to head home. I also want to give great remarks for Greg Pope and his team, the therapists, and the young ladies that help out in housekeeping in the kitchen. Oh my goodness, the meals have been the best meals I think I've had in Mexico. They should be working at a good restaurant, the meals that they turn out. The house is extraordinarily comfortable. It's in San Miguel. I'm very familiar with San Miguel. We have family here. We've come many times. But for those of you who have never been to San Miguel, if you were not even here for an operation, it would be worth your time to visit. It's just a wonderful old Spanish colonial town, lots to do. Everyone speaks English, so it's easy to make your way around town. It's just on a vacation alone, San Miguel is absolutely a destination spot. So you couldn't do better for a recovery center in the casa, in the location, and again, by far and most important, the doctor. I really strongly believe that regardless of locale, regardless of cost, Dr. Simone is an exceptional doctor that's worthy of putting your health and your future into. Thank you very much.